Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning and welcome to today's professional. I'm Dr. Wesley Shankland of Lima Dental Associates and Lima Community Dental. And today, again in studio, I have with me Mandy, who is one of our very fine, and I mean that, fine dental assistants at the Lima Dental Associates. Today we've talked, and I think we're going to talk today about cancer. And it's a grim topic, but something we've got to talk about and be serious about that. Welcome today. Nice to see you again.
It's nice to see you again. Thanks for having me.
Thank you. It's a joy to have you here. You work with a very fine dentist at Lima Dental Associates, and all our doctors, I think, are wonderful. And we all, with our hygienists, are very attuned to looking for cancer. Do you agree with that?
I agree with that 100%. I see the hygienist all the time using a very highly specialized tool called a valve scope.
That's right.
On each patient that comes in, just to check for cancer, because we're not just concerned about your oral health. We want to make sure you're healthy all the way across the board.
That's a great point. This valve scope is a specialized instrument that the hygienists use to look at all the tissues in the mouth, and if there's an abnormality that we can't see with our naked eyes, this just blows it up. We see it right now. So I have personally found maybe 4 or 5 people with cancer this year alone, and that valve scope is ideal. It just blows that thing up. So you probably know that oral cancer is on the rise, and it comprises at least 5% of cancers. Now that's a lot.
That's a lot, and that's scary that it's on the rise. But
that's right.
With the use of alcohol and tobacco, both the chewing tobacco and the kind that you smoke, it's scary that it's on the rise, but it's not surprising that it's on the rise with those numbers climbing.
I saw a woman just today before we came to the studio here who was terrified she had cancer. She had an area that looked like it could be, and when I assured her it was not, she almost broke down and wept. So it's a common thing to have, and if any of our viewers have an area in their mouth where it seems to be red, or it seems to be a white area or a rough area, or a bump comes up, or there's a smell or a lot of bleeding in one spot, come and see your dentist or your hygienist immediately. We'd be glad to see you at Lima Dental Associates or Lima Community Dental, because we are really attacking this and trying to stop this from hurting anybody. Our mouths are so vascular that once cancer begins, it can metastasize, spread throughout the body very quickly. So again, it's important for us to look at that. Don't you agree?
Absolutely.
And I know that Dr. Crowley, with whom you work, and myself and all our other doctors look immediately on all patients for oral cancer when we look at them, just to say hello to them. And so I appreciate it. And folks, we wish you a happy 4th of July.